6 is the cytokine. Stimulation is the endotoxin microbial product or the immune complex or physical injury. Stimulate the macrophage to release the tumor necrosis factor. Tumor necrosis factor may have the local effect or the systemic effect. First is the local effect is their endothelial activation. Stimulation or the increase the excretion of the endothelial adhesion molecule, and in the WBC it increases the response of the neutrophil, and in the repairing process proliferation of the fibroblast and increases synthetic collagen. Local effect is the first local effect macrophage causes the endothelial cell activation, stimulate the excretion of the endothelial adhesion molecules. In the WBC increases the response of the neutrophil and the repairing process like the proliferation of the fibroblast and increases synthetic collagen molecule. In the systemic effect there is fever, it causes the leukocytosis, increase the acute phase reactive protein and decreases the appetite. First is the fever and then leukocytosis and increase the acute phase reactive protein and decrease the appetite. 7 is the chemokine. They are the selectively attract the WBC to the site of the inflammation. There are the 4 major groups of the chemokine is there CXC, CC, C, CX3C, and they stimulate the chemotaxis, inhibiting the neutrophil. First, they selectively attract the WBC to the site of the inflammation. There are the 4 major groups of these chemokine like the CXC, CC, C, and the CX3. They stimulate the chemotaxis and inhibiting the neutrophil. Next is the lysosomal constituent of the WBC. One more thing I forget that the interleukin 6 and the 17 also the cytokines. Interleukin 6 is secreted from the macrophage and interleukin 17 is secreted from the T lymphocytes. They stimulate the neutrophil recruitment and they also causes the local effect and the systemic effect. Interleukin 6 is from the macrophage and interleukin 17 is from the T lymphocytes and they stimulate the neutrophil recruitment. Eighth chemical mediator is the lysosomal constituents of the other WBC. First, WBC neutrophil and then the monocyte or the macrophage. Neutrophil there is a granule is there. First is the smaller granule or the they are the secondary granule, and the larger granule or the azurophilic granule they are the primary granule. In the smaller or the secondary granule there is the lysozyme, collagenase, gelatinase, lactoferrin, plasminogen activator, histaminase, and the alkaline phosphatase enzyme. In the larger or the azurophilic granule there is a myeloperoxidase enzyme which will help in the formation of the hypochlorite in the reactive oxygen species formation, and the lysozyme defensin, acid hydrolase enzyme, elastase enzyme, cathepsin G, non-specific collagenase enzyme, and this proteinase 3. In the monocyte or the macrophage there is also acid hydrolase, collagenase, elastase, phospholipase, plasminogen activator, and which causes the chronic inflammation mainly. Ninth, cell derived chemical mediator is neuropeptide. They are the small peptide like the substance P, neurokinin A, etc. Source, they are from the sensory neuron and the WBC. They causes the vasodilation and increase the vascular permeability. Neuropeptide have the two things, that is that they are the small peptide and like the substance P and the neurokinin A, or their source is the sensory nerve or sensory neuron and the WBC, and they causes the vasodilation and they increase the vascular permeability.